Where are you on this one? Because I'm slightly conflicted on it. Maybe you can help me, Claude.
Sure. I think it's a tier system in regards to our healthcare, and we have to look at the historical elements of our health service and where we've had, I think, some shortfalling ministers, unfortunately. I think we've had an issue where we need to look at the interlink of climate change and of how that has an effect on health.
Climate change? How does that affect this?
It affects it in the fact that if we're looking at new gas and oil deals that are going to basically put 2 million tons of CO2 into our atmosphere and basically affect the poorest communities within our community, then that's going to be a problem. So we need to look at those kind of issues. And
Claude, you're not going to tell me the current state of the NHS is the fault of climate change.
Well, if we look at winter that's coming up now, we're going to have an increasing waiting list because of basically the winter and the effects of winter.
Yeah, because it's still very cold. So it's not because of climate change.
However, if we have a system that's basically being used and not really being funded, then these are the pressures
it's getting record levels of funding. I mean, you might say it still doesn't keep up with demand, but I don't think we can say the NHS isn't being funded. It's never had more cash.
But there's issues where we've had doctors that are going on strike.
Yeah.
We feel that the poor conditions are not meeting to their needs of capacity, for example. And then also the other question that we have to look at is why do we feel that America has got, like the Obamacare, for example. I think there's been a very interesting cross-border transaction where we've seemed to go more private and the US has gone kind of public with their Obamacare. It's very interesting to look at.
Do you think people in this country, do you think if you can afford to pay in Britain, do you think you should? Should we be encouraging and I wouldn't even say the wealthy, should we encourage people in middle classes to stop relying